Good evening. My name is Jeremy Philibom. Tonight I will be discussing the topic of bee stings and demonstrate how to treat them. Imagine you're enjoying a great day in the outdoors in the summertime. You were out of bug spray and you didn't want to hold up progress by stopping to get some. All of a sudden, ouch, you've been stung by something. You don't know what it is, as you've never been stung by anything before. A friend of yours that went along for that day advises you that it was a bee sting. You're not sure if you're allergic to bees. You're also not sure if you should pull out the stinger. As all of this is going on, your friend advises you that the infected area is starting to swell. What do you do? Well, tonight I plan to tell you what to do. For instances similar to these, an individual needs to know how to treat bee stings and, of course, identify them first. On a personal note, when I was a child playing baseball, a teammate of mine got stung by a bee on the neck. He was a tough kid and he went ahead and decided to play through the pain. However, his parents didn't realize that he was allergic to honeybees, and his neck started to swell, and they had to pull him from the game to seek medical assistance. Based on information like this, I have 4 points I would like to make tonight. Number 1, to understand that a bee is what stung the individual. 2, to go ahead and understand the initial response right after the bee sting. 3, to take the appropriate action for remedy depending on the pain level. 4, seek further self-remedy beyond that point if serious issues occur. Zachary Wang from the Michigan Beekeeper Association, in conjunction with Michigan State University, provides this photo of a bee in flight. If the perpetrator that stung you looks like this, then you've been stung by a bee. You may not always have the bee there to see, so then you will want to just look at the area that was affected and get a visual on it. That visual may appear something like this. Here you can see a change in texture, not as much discoloration with this as may occur sometimes, but the skin narrows down into a centered sting spot. Once we've identified that it is a bee sting, next you want to remove the stinger and the venom sac. The simple illustration from Mellowbee for Kids website shows that you should attempt to remove the stinger with your fingernail and not to pull it out like this. This will lower the risk of chance of further venom entering the wound. Some people may be afraid to pull at the stinger directly. In that case, the Mayo Clinic website tells us that tweezers may be used instead, provided that you're very careful not to further inject venom into the wound. WebMD and Dr. Melinda S. Rettini, specifically, offers up some basic symptoms and treatments to bee stings. The symptoms are swelling, pain, and itchiness. Now, if swelling is to occur, a few things that you can do is first, you can place an ice pack on the affected area. You can place a cold, wet cloth to compress the area. And you can elevate the area if necessary. Now, if pain and itching occurs, for pain you would want to use a common painkiller depending on the individual. And for swelling, you can take advantage of an antihistamine. Now, sometimes these home remedies may not work, as the issues may be more serious and may require additional professional medical attention. Dr. Jacob L. Heller and Dr. David Zaev of the U.S. National Library of Medicine on November 13, 2014, provided information that tells us about what some more of these serious symptoms and medical reactions should be. First, there could be trouble breathing. Second, there could be face or mouth swelling, as shown by this photo again by J.K. Keller from WebMD. There could also be chest pain. There could also be rapid pulse or heartbeat. Or there could be dizziness, nausea, or vomiting. In these cases, the reaction to these situations could be Reassure the individual to remain calm. Utilize an EpiPen if they happen to be the owner of one. Call 911 or seek assistance from a professional, medically trained individual if they happen to be available on site. Go to the hospital or doctor if necessary, or follow up with a physician as needed. In conclusion, we've learned how to identify bee stings and what some of the common treatments are as well. We also now know how to remove the bee stinger and the venom sac. We also know what the common home self-remedies will be, and also to seek medical attention if needed for more serious issues. In closing, I would like to leave us with a startling statistic. Dr. Robert A. Marsh and Thomas Arnold from the Merck Manual in May 2013 say this: in the United States, 3 or 4 more times the people die from bee stings than from snake bites. I would like to thank you all for your attentiveness tonight on this topic, and I wish you all a good evening.